Questions about the recent beauty influencer that passed away from cervical cancer, and I just wanted to comment not on her actual case, because I don't do that. I don't speculate. I was not taking care of her, and I just feel like it's disrespectful to her memory. But I want to address some of the questions I've been getting. And please know, I literally did not look her up, so I have zero idea about her case in particular. So this is not about her, but specifically about cervical cancer. So the main question is, how in heaven's name can cervical cancer get missed and be thought to be fibroids? So there's something called a prolapsing fibroid, and that's when the fibroid actually is delivering itself through the cervix. And yes, it is as terrible as it sounds, but when you look in, it can look like a crazy mass that is just filling up the vagina. It is very bloody, and it can look like a cancer. So I can see how, for an untrained eye, one can look like the other, very specifically an untrained eye. So that can happen. I've been also sent a lot of comments, and there's a theme of, well, we should be screened for cervical cancer like every month or every 6 months or something crazy like that. And while I have my own issues with the cervical cancer screening guidelines as they currently are, there are a couple things. For somebody who is having a complaint, what you need is not screening. You need evaluation, and those two things are different. So yes, if you have a complaint, you're going to make sure your screening is up to date, or your doctor's going to make sure of that. But you need something else, like actual specific evaluation for the problem that you are having. Routine cervical cancer screening is different. That's for somebody who has no issues, or maybe has had issues in the past that have resolved. And that's also different than follow-up, than diagnosis. So if you've had an abnormal pap smear in the past, you need diagnostic testing, meaning a colposcopy, where they look at your cervix under the microscope and do biopsies, possibly take piece of your cervix. Those are all different things. So a blanket statement like everybody should be getting pap smears or cervical cancer screenings every month or every 6 months not only doesn't make a whole lot of sense, it can actually do a lot of harm, because these are not painless procedures. These are procedures that can have false positives. There is some morbidity that is associated with over screening. And as I mentioned before, if you have a complaint like heavy bleeding, what you need is not screening. And I guess the most important thing that I want anybody to take away from this video is that if you are having an issue, you need an evaluation. Being brushed off and told that this is normal, even telling yourself that, is not acceptable, because it could cost you your life, right? So if you have a complaint and nothing is done, push back. Ask what is the next step in evaluation. And if you can't do that, maybe consider finding another doctor. And if you yourself, you have something that's going on that you feel like is just not right, but you don't want to go in, you've had bad experiences with the doctor before, I would encourage you just to reconsider, because you do need to get evaluated, right? There are certain things we do for heavy bleeding or pelvic pain that is above and beyond something like a pap smear. So let me know if you have any questions about this in the comments.